Hi, guys. I am so happy to be here with you this evening. My name is Dr. Jamie Adam, and I am coming to you from the Nursing School Masterclass. And tonight I'm talking about exam anxiety, test anxiety. And this week in our community, we've been talking about things you can do leading up to your exam, ways that you can decrease your stress and decrease your anxiety. And so tonight, I'm going to focus on what you can do like in the moment. So you're sitting there, you're taking the test, you become panicked and overwhelmed. And so I'm going to give you some strategies that you can use in the moment to help you push past that fear that happens to everyone in the middle of a test. So I'm going to give you those tools tonight. If you have questions, post them in the chat. I'm happy to answer them for you at the end. And if you haven't watched my workshop on how to study, so 4 steps to getting A's in nursing school, do that because that's a great system for you to follow so that you can know that you're studying the right way. I just came across an article recently that said 50% of college students have never been taught how to study. So, of course, nursing school is going to be really difficult if you feel like you're just winging it or you're trying to do what someone else, has said is helpful and then you try to do it and then you find that it's not, and it can be very nerve-wracking. So, I have that resource for you. Go to my website and you can go through that workshop, and it will equip you for a new method of studying that's evidence-based for nursing school. Okay, so tonight we're talking about test anxiety. So I have 4 things that I want to share with you that are going to make a big difference for your exam. And before that, I want to share a little story with you. So about 4 years ago, I had a student she was a really good student. She would typically score in the low 90s on her exams, sometimes high 80s. So, I mean, she was not what I would say anywhere close to in danger, but this was pharmacology. So this is a tough course. And something happened with her. So I noticed on her third exam, there were 4 exams in the class, and I noticed on her third exam, she scored a 54%. And it stuck out to me because I wasn't used to seeing that happen. I wasn't used to seeing that score from her, especially. And so when she got the 54, I asked her to come meet with me. And we looked at her exam together to see how she did. And I couldn't believe it. She got the first half of the test. She got like the first 25 questions right, or maybe it was 26 questions right, and she got the last 24 wrong. And so as we looked at this together, I couldn't imagine why she had gotten the first half of all the questions right and the last half, all of them wrong. And of course, the questions are randomized. So it's not as if the questions at the end were harder. And so when I asked her what had happened for her, she said that she was going along on the test, doing just fine. And that she got to a question that she didn't know. It made her anxious. She made her way through that question, but then she got another question that she didn't know, and that scared her. And then she got another question that she wasn't sure about. And she said getting a couple of questions in a row that she didn't know or she wasn't sure she was answering correctly, she said it just launched her mind into this torpedo where she started thinking, what if I fail this question? What if I fail this test? What if I end up failing this class? What if I end up being dismissed from the program? And so she just had this cycle of anxiety and panic that she was going through in that moment that completely derailed her ability to finish the test with a clear mind. And she said that she just felt like her mind went blank, and then she was just, in tears and just went through and just answered the questions without thinking because she was so overwhelmed in that moment. So that her experience, really struck a chord with me because that test is meant to measure how well she understood the information. And instead, I feel like it didn't do that. It really was affected by the test anxiety that she was experiencing. So that made me passionate about trying to find a way to help my students so that they don't feel so anxious during exams. So, talking about test anxiety, I mean, having a little bit of anxiety during a test is completely normal. It can be beneficial because it helps you focus in on what you're looking at and reading. It motivates you to do your best. There's that hyper alertness that you get from being really ultra focused on what you're doing because you feel this pressure. And so that is not a bad thing. That can be very helpful. So the point that it flips over into unproductive anxiety is when you become so anxious that you can no longer think clearly. You become frozen. You feel this fight or flight sense of I need to get out of this exam. I need to hurry up and answer these questions and get away from this because I'm miserable right now. So when anxiety reaches that level, it's not productive. And so often students can forget their own name in that moment. It's just everything goes blank. So the idea of being able to recall deep and meaningful information that you've learned from class that you're trying to apply in a story problem fashion is just unrealistic. It's not going to happen. So, this is what I want you to do. Okay. So, these are your 4 steps. So, the very first thing, this is happening just minutes before you start the test. I want you to be 5 to 10 minutes early for that exam. So, I don't want you to be 20 minutes early. So if you get there too early for that test, then sometimes it can be anxiety producing because you've got people in the room that are talking about topics, or they're talking about their stress, or they're talking about what they're anxious about. And that can be very nerve wracking, and it can really affect your own self talk if you hear other people talking about being scared to death. So don't be so early that you absorb everyone else's anxious energy. At the same time, you want to be there early enough, so 5 to 10 minutes early, so that you can get in your seat, sit down, take a deep breath, be calm. If you're taking a virtual exam, logging on 5 to 10 minutes ahead of time, just in case you have some kind of technical snafu, is so helpful. So, getting in with enough time that you have 5 to 10 minutes just to focus and take a deep breath is going to be so helpful for you being able to go in to starting that exam. So there's this thing called attention lag. So whatever you were thinking about before the test, it lags in your mind. So you're still thinking about fighting traffic trying to get there. You're still thinking about that conversation that you heard in the hallway between, your classmates that are stressed about this exam, or they're angry, or they're upset. So you want to give yourself time to be there early so you can clear your mind and calm down and focus. Okay? So, but when you get there early, it's not that I want you to get there 5 to 10 minutes early and then just sit and breathe. I want you to do something. So, I read this study where students that wrote down on a piece of paper everything they were thinking and feeling for about 5 to 10 minutes before the test, they scored higher than students that were just sitting there. So there's something that happens when you take all the anxious energy before a test and you put it on paper. It helps to get it out of your mind onto paper, and now it's not muddying up your mental space. So if you have a scratch piece of paper, or you're able to, even at home while you're waiting for your virtual exam to start, take a few minutes with that free time that you have before the test. Take those last few minutes and just jot down what you're thinking, what you're feeling, and get it all out. I would encourage you to do that. Okay, so that was step 1. You're going to get to your exam 5 to 10 minutes early. You're going to write down your thoughts, because the data proves it can increase your exam score. So let's do that. The second thing I want you to do is to take deep breaths. Okay, so this is happening during the exam. So now you've gotten into the exam, you've gotten through maybe the first couple of questions, or maybe you're halfway through, and maybe you come across a question that you don't know and you're feeling nervous, or you're starting to have doubts, or you're starting to fear that maybe you're not doing as well as you wanted to do, and what's going to happen if you fail this test. So in that moment, I want you to change your breathing. When you are in fight or flight mode, so when sympathetic is triggered and you're anxious, you will tend to take short breaths that are shallow. So it's like, you're scared. So that's what people do when they're anxious. So in order to try to move yourself away from sympathetic fight or flight back into parasympathetic, which is a calming, which is the calming control of the body, you want to change your breathing pattern. So if in that moment you exhale, hold your breath for a couple seconds, inhale, maybe inhale through your nose, exhale through your mouth. There's all kinds of breathing techniques that you can do. I've even seen where you breathe in, you hold it, and then as you exhale, you say the word relax in your mind. So just in your head. But whatever you can do to slow your breathing down. And the idea is really to breathe from the diaphragm. So if you stick your hand on your stomach during the exam on your abdomen and try to focus breathing from your diaphragm versus keeping everything tight right up here as you're taking short, shallow breaths because you're panicked. Okay, so changing your breathing. This is what's recommended for patients that have panic disorder. So in patients that have panic disorder that are prone to having panic attacks, the same advice is given. Focus on breathing from the diaphragm and try to shift your breathing pattern, which will help calm you down. So it really does work. Okay, so that's number 2. Number 3 is to go slow. So I think it's human nature to want to get through the exam because it's difficult, it's challenging, it's a little scary. So the idea is to slow down, read each question thoroughly, read each option thoroughly, and take your time. So I teach seniors and they take all kinds of Kaplan exams, which Kaplan will give them data about how often they change their answer and whether they change it from right to wrong or wrong to right or wrong to wrong. And so I get a lot of data from those tests. And what I have found is that when students change their answer, the majority of the time they change it from wrong to right. There are situations where students change it from right to wrong, but they happen less often. So let me help you understand why. Critical thinking takes time, and your brain takes time to process information. So have you ever been in a conversation with someone and you got to something and you couldn't remember a name or a word, or you were trying to come up with something and you were like, oh, what is it? What is it? It's on the tip of my tongue. And then, you can't think of it. So you're like, oh, forget it. And you move on with the conversation. And it's so funny. The second you move on, it's like that name or that word pops into your head. And you're like, oh, this is what I was trying to say. So when you're processing a question, you may look at it and say, okay, I'm pretty sure C is the right answer. I'm pretty sure D is the right answer. Don't move on. Stay right there for just a few more seconds. And make sure that you've thought through why the other options aren't correct, so you know the rationale for why you didn't choose the other answers. And by giving yourself more time, you allow your brain more time to process the information. It gives your brain time to critically think. So if you have 60 minutes to take a 50-question exam, you want to spend at least a minute per question, maybe a little over. You want to use your time. So there's no race. There's no reward for finishing early. and really use the time you have so that you can process the information longer. So, and I know there's always students that say, I always change my answer to the wrong one, and I feel like I do this. And in situations like that, what I find is that it's not a critical thinking issue, it's a confidence issue. So if you're feeling a lack of confidence about the topic or the question, then you can very easily talk yourself out of the right answer. So that does happen. And that's why I recommend concept mapping as a study tool, because that's the way to know that you know the information so that you can have more confidence when you go into the exam, so that you can know the information well enough to be able to answer the question. Okay, so number 3 was go slow. Okay, and then the last thing I wanna share with you is thinking about a process for how you answer questions. Okay, so when you are administering medications, we teach you to follow the medication rights. We tell you that if you follow the medication rights, making sure you have the right patient, dose, route, time, all of those, then we know that you will give the medication safely. So, what's great about following those medication rights is that everything else can be going crazy for the nurse. You can have call lights going off, you can have doctors trying to talk to you, you can have family members trying to ask you questions, you can have all kinds of stuff happening in your personal life. But if when you go to pass medication, if you follow the medication rights, then your chance of making an error is very, very slim. So the difference is having a process that you can fall around and everything else is crazy. So the same applies for exam questions. If you then you will have a way through the anxiety, because when all else fails, go back to the system. What is the system you were taught? So I talked last week in my video on how to answer NCLEX questions. And so I teach a very simple process. It starts by you want to identify the topic of the question, or I'm sorry, you want to identify the type of question, right? So you know whether it's select all that apply, or multiple choice, or short answer, or drop and drag, hotspot. So you want to identify the type of question first. And then the second thing is you want to identify, make sure you know what it is you're being tested on. So, and a lot of that depends on the course that you're in. So if you're in a pharmacology class, of course, you're going to be, a lot of the questions will be more focused on pharmacology, on the drugs themselves. And then the third step there is to really think about just ruling out distractors. So sometimes that's easy to do. You can easily say, okay, it definitely can't be D. I know it's not D, and you can cross it out and move on. If you don't know or you're not quite sure, you just skip to the next section or skip to the next step. And so that is, considering assessment over action. So, is there anything else that you need to assess to inform you as the nurse so that you can make a better action or evidence based action, or intervention? And then the next step is prioritizing your intervention. So that's where we look at Maslow's hierarchy of needs, and we make sure that we're dealing with physiologic needs first, airway, breathing, circulation, safety. And then, of course, we look at pain and then feeling, or those psychosocial priorities. So, okay. And then that's how you choose the right answer. So being able to fall back on a system is so helpful, so that no matter what stress you're feeling, you just go to the system. So, I hope this has been helpful to you. The 4 things that are going to help you with test anxiety in the moment is to get to class early, write down what you're stressed about, write down your thoughts. The second thing is to take deep breaths and change your breathing pattern so you can stay calm. The third thing is to go slow and use the time you've been given so you can allow yourself more time to critically think. And the fourth thing is to use a system when you're answering the questions so that you can be thorough and so that you are going to be more likely to choose the right answer. All right, guys, what questions do you have, or what questions can I answer for you? And I'll tell you that next week's topic is going to be on what to do after the exam. So, how do you review your exam? Make sure you're getting the most out of that exam review. What do you do if you disagree with a question? Maybe you got it wrong, but you feel like it should have been right. And so, what does it look like to appeal questions? And then, of course, that leads to sometimes uncomfortable conversations with professors. So I want to talk about those things next week. It'll be next Wednesday at 8:30 Central. So I will post a link for that so that you can me. But otherwise, thanks so much, guys, for joining. Please post your questions below. I'm happy to answer them. And um, and thank you again.